Okay, I think we have the tech figured out. Thank you again. And welcome back. Hard to believe that we are at the last session of the day and the last session of the forum, but we are lucky to be joined by Dr. Dawn Shepard. Dr. Shepard currently serves as the Vice President of the Infectious Diseases and Vaccination Programs branch of the Public Health Agency of Canada. Prior to this position, he was the Executive Scientific Director of the Antimicrobial Resistance Task Force at the agency. A professor in medicine and microbiology and immunology at McGill University, he practices medical microbiology and infectious diseases at the McGill University Health Center, where for the last 20 years, he has led a research program focused on understanding how bacteria and fungi resist killing by antimicrobials. Welcome, Dr. Shepard.
And I'm still fighting with the tech here, so give me 2 seconds. There we go. I think I'm officially online now.
Wonderful.
Thank you so much, Maddie. Am I able to get some slides popped up on the screen?
Yes, right.
That'd be a good start.
Now. And
All
everyone
right.
see that? Yes.
There we go. Thank you so much, and apologies for the little technical difficulties in fighting my way through Zoom. Zoom and Teams just really don't seem to play well together, I have to tell you. So thanks so much for the invitation to speak with you today. I have been able to join a couple of the sessions, but not much over the last few days, but I've heard that it's been quite the enjoyable experience with a lot of good discussion, in particular around areas where climate change and environmental change are affecting the distribution of pathogens. So we'll touch on that a little bit. So today, what I want to touch on, if you can flick me over to slide number 2, is sort of 3 main points. The first is a little bit of an overview for those of you that haven't been in all of the sessions. I'm going to try and pull together a bunch of the observations around what we've seen with climate change, the effects that it has on health, with a particular, of course, focus on infectious diseases, dear and dear to my heart. And then a little bit of how we view it from the Public Health Agency perspective and some of the work that we're doing inside the agency to tackle the challenges, some of the gaps we see, some of the directions we think that we would like to see work move in. And then I'm going to leave you with a couple of questions and challenges that we'll deal with during the discussion. And I'll tell you right away, I'm going to be asking you and leaving you with one challenge. And that challenge is that if you sort of stop and pause and think about everything you have heard in the last 2 days and that everything we're going to talk about for the next sort of half hour or so, just to ask yourself this one question, which is, what is the one thing you can do collaboratively, reaching out in your world to break down some of the silos in this space and to move the needle just that little bit? Because I think that's the place we're at, where we really need to all be focusing on how we can move the needle forward that little bit. So with that, let's go on to the next slide. Okay, climate change. The last year has to have gotten everybody's attention on how important climate change is. I'll tell you personally, it was a very, very tough year for myself from a climate change perspective. So I live in northern Quebec, just north of Montreal, and certainly had to deal with the smoke events related to the wildfires all summer. I also had the joy of having a tornado touch down on my actual property and wipe out a 100-year-old forest that was one of the reasons that I actually moved to where I moved. And if you really want to see the visceral and powerful effects of climate change firsthand, just take a walk through what a forest looks like after a tornado has been through it. It is a absolutely visceral and gut-wrenching experience to realize the amount of power that nature is able to bring to bear to destroy things. So that's just, of course, the start of it. We've had flooding events. We've had beyond the smoke and wildfires. We've had heat domes. We've had changes in permafrost levels. I think that the jury is not just out from a scientific point of view, but also from the way that we live our daily lives. We're seeing this affect us on a daily basis. And of course, this has a lot of impacts in health. We'll talk a lot about infectious diseases, but there's a lot of knock-on effects in health. And one of the ones that we tend to not think about, although again, I'll tell you, it was really brought home for me, is the effect on our mental health. really tough to imagine how people are dealing with this. We'll talk a lot about equity, but how do you deal with the fact that if you live in Yellowknife, you were evacuated from your home, and people that were sheltering in Yellowknife were evacuated 3 times before they even got there? This is a unbelievable disruption on people's lives. And if you're not well endowed with resources and a solid community structure and safety nets and flexibility in your workplace and everything else, this kind of disruption can be the thing that pushes people's lives over the edge. And I don't think we give enough attention to the knock-on effects that this has on people's mental health and their overall well-being. So with that, let's go to the next slide and we'll dive in a little bit to my favorite topic, which is infectious diseases. And it's actually kind of challenging to talk about climate change and infectious diseases because there's so many direct and indirect ways that you can see the effect of all of climate change on pathogens. There's the obvious ones as we see major shifts in geography and ecology. We have species that are mixing that have never mixed before. We have anthropomorphic effects on that as well as we ship animals and plants around the world and put them in places where they certainly didn't originate or evolve. And you can see dramatic effects where pathogens are exposed to new hosts. And that, of course, is the whole zoonosis story. And we hear this famous statistic that many of us have heard. I'm sure it's been mentioned here that there will be 300,000 new first encounters between species that have not actually interacted before, and that's the perfect setup for zoonotic type diseases. Then there's the obvious one that we love to talk about in Canada. As you change the climate, you change the distribution of vectors, and Lyme disease is the poster child for how Lyme disease affects infectious diseases in Canada. And we've all seen, and particularly if you live in one of the southern parts of the provinces, you've all seen the march northward of Lyme disease. I'm from Quebec, and I have literally watched it march northward over the past few years, and I'm dreading the date when I actually go onto the postal code map and realize that it's in my part of the Laurentians. It will happen in my lifetime at the rate that it is going on. But it's not just those obvious ones. There's some that we don't think about. A lot of the environmental pathogens themselves are greatly influenced by the way that climate change affects our environment. I'm a mycologist by training. I study fungi. I love fungi. And there's some superb examples in the fungal space. The first potential climate change induced pathogen is, of course, Candida auris. And for those of you that have followed the story that people have brought forward as a hypothesis, still isn't fully proven, but it's a pretty good hypothesis, is that this is a fungus that was living in sort of brackish, warm water marshes, but really wasn't able to make it at 37 degrees body temperature. But as global warming increased in those areas, the organism adapted to temperature and managed to get to the point where it could cross that thermal barrier and infect humans. And we see it in humans. It's still a peripheral type of pathogen. It likes to hang out on skin and appendages where the temperature of the body is a little cooler. So the big question that people have raised and is how did this pathogen, which literally had never been detected in a human being until I think 2006-ish, how did it suddenly jump into human populations? And climate change may indeed be the smoking gun. Closer to home, we have our own fungi that live in the soil. There's histoplasma in the St. Lawrence Basin. There's blastomyces in our forests. But there are some of these soil fungi that infect humans that don't live in Canada, but there's the potential for them to migrate their way northward, just as the ticks have done, and to enter North America. The big example here is coccidiomycosis, otherwise known as valley fever. People talk about what's going to happen with climate change here, and there's some very, very scary maps that show that its distribution could spread from the American Southwest deserts all the way up into the Okanagan over the next 10 to 20 years as temperatures are raised. The soil conditions are there, but the fungus at the moment isn't. If it gets established, then we will have acquired one more endemic fungal disease, and frankly, we really don't need any more of those. So that's just a few examples. If we move on to the next slide, it's not just, of course, the pathogens that we have to think about, but it's the effect on humans. And I alluded to that a little bit earlier on when I was talking about the climate change. But, in true public health spirit, we need to recognize the fact that the burden of climate change on susceptibility to infectious diseases and indeed to all health is really unbelievably unequal. It's a very different experience to deal with a smoke and heat event if you live in an air-conditioned house with lots of room and you can actually stay indoors. Or if you don't have small children, or if your small children have a place to exercise that's safe and that has good air quality. How do we deal with messaging to people who live in non-air conditioned homes when we're simultaneously telling them to cool off, open a window so you get a breeze, but close your window because there's smoke and that'll be dangerous? Resources that people have in their lives influence their resiliency. And that obviously is highlighted in a lot of communities, whether it's our indigenous populations, people who are lower socioeconomic status, our racialized communities and northern communities. They really experience these things very differently than people who have more social advantages. And we need to program this into the way that we think about the impacts of climate change at a personal and at a community level. You go to the next slide. So formalizing this a little bit and taking this into a more programmatic view from a public health perspective, I think one of the places to start is these two documents that I've got here in front of you, because they give us a really good kind of place to start looking at what are the obvious gaps that we have in dealing with climate change and a public health and health perspective, and then what are the potential ways that we can move to action. So the first one on your left, the health of Canadians in a changing climate, is a very broad document that covers risks related to climate change, and that it covers everything from mental health and air quality to, of course, infectious diseases. And Nick Ogden, who I know has been at this conference and has done some superb work in this area, is the lead author of the infectious disease chapter. And I encourage you to go and have a look at it if you haven't read it, because it really outlines a lot of the unanswered questions and the gaps that we need to address across the sort of various big buckets of infectious diseases that we're concerned about in this space. So moving beyond the obvious vector-borne diseases, and hey, what type of babesia is crossing the border and present in Canada today, all the way across into the foodborne, waterborne, and zoonotic diseases, and my favorite, the environmental pathogens. What is climate change doing in that space? We're really good at saying what could happen. There's a potential. I could model this. I come up with a hypothesis, but we don't really have quantitative methods, and we haven't done quantitative assessments and ways to test and to actually then come up with surveillance strategies that will allow us to monitor all of these potential things that climate change could do. And whether that's looking at algal blooms or cholera growing in warming coastal waters, or as I said, the migration of cocci northward. There's reasons to think all of these could happen, but there's also reasons to think some of them may not happen. And we really need to figure out how to use our resources most effectively to identify which of these threats are going to be the most important to Canadians. So that's kind of the gaps and what we don't know and where we should try and perhaps put some of our efforts to understand. And then there's the what can we do and what should we be thinking about doing? And again, moving from more the pathogen side over to the host community and public health side, I think that the Chief Public Health Officer's report from 2022 gives us a really kind of good blueprint for starting to look at this. It helps us to identify which of the populations that are at particularly highest risk and most vulnerable to the effects of climate change. And some of that, of course, is geography, but some of that is actually population and community characteristics. And then it actually gives us a building blocks that we can actually use to start to move forward in building more resilient systems. I think I'll highlight a few of them. It's a very long list, but I think public health monitoring is obviously where we're thinking about, and I alluded to that on the pathogen side, but it's not just public health monitoring of pathogens, it's also monitoring of community risk and vulnerability. And then there's specific community-based programs that can be done at all levels of government to improve resiliency and adaptation of individual communities. And those are going to be different in different places. In downtown Toronto, you need to find places for people to deal with high heat events and heat sink phenomena. You flip that around and look in Yellowknife, obviously we're looking at places at dealing with fires and smoke events. So this needs to be very community specific and address the community needs and the community risks. And then I think lastly, understanding the communication and the knowledge mobilization around this. As we learn and as we have experiences like we did this year with wildfires, it's really important that these lessons learned don't just get lost in the back of binders somewhere in lessons learned exercises, but they get shared and hopefully operationalized into strategies that can actually make the next one easier for everyone, because there will be a next one. We all recognize this. All right, over to the next slide. We're continuing to drill down here. So now we're drilling down to the actual agency itself and what are we doing in the infectious disease and climate change space. And that's our infectious diseases and climate change program, obviously. And so this is a program that's within one of the centers in my branch that works across all of the standard levers of public health. It does quite a few things that I'm going to drill down into, and that little gray box over there on your screen is to highlight the areas that I'm going to expand in the next few slides. But I think it's important to mention that a few of the things they do include supporting the Canadian Lyme Disease Research Network, sort of CLIDERN, the Federal Framework on Lyme Disease and Action Plan, and some funding to the Métis Nation for work on climate change and health activities. Those are specific sort of fundamental functions that I'm not going to get into on the next slides as I get into the more detailed aspects. But I want to walk through really the surveillance and monitoring piece, then sort of knowledge mobilization, which brings together those two middle boxes. And lastly, our partnerships and engagement and how we are working to support community-led and community-driven initiatives leading to action in all of these spheres. So if we can go to the next slide. Monitoring. So I'm becoming programmed now to say monitoring every time I see surveillance. So how can we improve our monitoring? And I think the important thing to understand here is that we really need to take a multimodal approach here. This is not federal only driven. This is not provincial only driven. This is bringing together everything that's going on at all levels of government and perhaps most importantly, citizen science, because citizen science is really taking an important role in this space. And this is an area, of course, when we're talking about a lot of these infectious diseases where a One Health perspective is really critical in informing what we're doing. And you can monitor Lyme disease by monitoring ticks just as easily as you can do it by monitoring human cases. And both of them are important and both of them have a purpose. So there's been a lot of work in this space, particularly in the vector-borne diseases. It's generated some very interesting products, as I alluded to earlier, one of which I use myself on a regular basis, and that's the interactive map of Lyme disease, where you can actually, and tick surveillance, where you can actually go to it with your postal code and see what your risks are in your area. Happy to say that St. Adolphe de Howard in the Laurentians remains relatively low risk. But I don't know how much longer that will last. And the other areas that we've done a lot on are the mosquito-borne West Nile disease as well. So have a look at some of these products. I actually find them very useful and have to admit, I actually used them before I even took on this role. Next slide. So moving past monitoring, all of this data then needs to be accessible to the people that need it. And usually the people that need it fall into one of two categories. There are the actual healthcare providers providing advice and care for individuals, or the general public who wants to reduce their own risk, and understand how to deal with the consequences of acquiring some of these diseases. So there's a lot of resources that are being developed here that are working towards either the professionals or general public. And then it's important for us to recognize, again, pulling on that equity string, that there are some groups that are particularly disproportionately affected or at risk. And that's an area where we've spent a lot of time trying to generate specific products to help educate and move people into a space where they have a little more agency to deal with their challenges. Children's material is some of the stuff that the group has come up with is really cool. I have to admit, there is a squirrel out there that will teach you how to remove ticks, how to do a tick check and how to remove them. It is one of my favorite videos to watch on YouTube, and I highly recommend you acquaint yourself with the squirrel and the tick education. And then, of course, all of this is only as good as how accessible it is. So in addition to making it appealing and interesting, we also have to make sure that it's inclusive. And that means translating it into as many languages and putting it into as many culturally safe contexts as is possible, because information is only as good as people who use it. Next slide. So the last area is our community support, and a lot of this is through our grants and contributions fund called the Infectious Diseases and Climate Change Fund, very creatively, right? That same fund name as our program name. And it does what you could imagine it does. It supports community and stakeholder-driven action in the areas of monitoring, knowledge mobilization, knowledge creation. A lot of citizen science work and a lot of very, very, very creative projects. I'm going to highlight a few of these that I think are particularly interesting. They're the ones that you have on your screen. So the first one is the Windsor-Essex County Health Unit, which is doing mosquito surveillance and monitoring and looking at local mosquito populations. And the reason I find this one really interesting is for those of you who've been following the news in the US, we had the first recent numbers of locally acquired malaria cases in the US in quite a few years. And the current working hypothesis is this is agricultural workers coming from malaria endemic areas who are then serving as a reservoir for local mosquitoes to transmit the pathogen. And so monitoring mosquitoes in this county, which has a large number of temporary agricultural workers coming in, I think is a really smart way to get ahead of that curve and see if we are at risk for seeing similar things, of course, that have occurred in Texas and in Florida. Another one that I find particularly intriguing is the First Nations Health Authority work on monitoring algal blooms and linking it to shellfish harvesting. I think, again, in Quebec, we saw this a long time ago, about 5-6 years ago, where these horrendous algal blooms were killing off fish and enormous amounts. But the thing that people tend to forget is that a lot of these algal blooms can produce quite impressive toxins that can accumulate and actually bioconcentrate inside marine shellfish. And so educating the people about when it's safe to harvest and when it is not safe to harvest shellfish is critically important in maintaining community health. The next one is the Conseil de la Nation Huron-Wendat, where we are actually working with nation members in a culturally relevant context for them to conduct their own tick-borne disease surveillance and to educate their own community in a way that makes sense to them as to how they can deal with monitoring for ticks and monitoring for tick-borne diseases. Again, this is kind of a self-determination type of program, and it speaks to the fact that we need to support communities in doing things in ways that work for those communities. People know best how they live in their own community. Next, we have my favorite one here, only because I think it has the best logo that I have ever seen. And if you can't read that writing on your slide, it's "What makes an expectant mother tick?" Absolutely brilliant. This is the Society of Obstetricians and Gynecologists who are working to develop knowledge materials and educational materials in pregnant or soon-to-be pregnant women so that they can understand and plan the risks of their activities during pregnancy. And I think this one struck me as particularly relevant when we were putting these slides together, because I was actually hiking last weekend near my house and literally got blown away by a young pregnant woman who went past me as I was toiling my way up a hill at about 5 times the speed I was going, and definitely drove home to me that you actually need to consider the fact that there are different populations exposed to different risks in different ways. My risk, of course, was getting exhausted before I got to the top of that hill. Okay, next slide, if you would. So that's what we're doing, and there's lots of things going on, but of course, there's a lot of more work that needs to be done, particularly as we see climate change accelerating and the effects of climate change accelerating. So beyond the sort of monitoring work, guidance work, community support, and knowledge mobilization, we have to ask ourselves, what are the next steps? And I would offer to you that one of the most important next steps, I think, is to work through communities. I said it a couple of times, and I truly believe this, is that when you're dealing with this type of challenge in public health, community-driven innovation, community-driven action, and working to support community resilience is really one of the strongest things that we can do to protect our population. And so we need to listen to our communities and our diverse amount of partners, and we need to think about the way that we can best support communities. And for that, I'll call your attention to the latest public health, Chief Public Health Officer report, the 2023 report, which focuses on a public health approach to emergencies, supporting and creating resilient communities to help them be better equipped to deal with and to recover more quickly from climate change and other emergencies. So I think that gives us a good direction forward. And so I'm going to stop on the slides with the next one, which is moving towards our discussion. And the discussion, I think we're happy to move in any direction people want to move in. But as I said, I'm going to issue that challenge for all of you to think about in your space, how can you broaden things a little bit? How can you take what you learned today and make that one connection to move your work a little broader or a little bit to the next level, or help someone else do the same thing with theirs? And how can we move forward in a more practical way? I think we all understand the potential threats, the actual threats, and the importance and reality of climate change. But I think we're still lacking a lot of concrete, very specific, what can we do in our space? What is the next action that we can think about doing? And with that, I'll be happy to pause.
Thank you, Dr. Shepherd. Sorry about that. I couldn't keep the slide on my screen and also move into the space where we can have a discussion. So if anyone would like me to paste those tremendous thought-provoking questions that Dr. Shepherd had into the chat, I can do so. But I also would like to open it up to anyone who in the audience has any questions for Dr. Shepherd. You can submit those through the Q&A feature. And again, I want to thank Dr. Shepherd for being here. I know we have one question in the Q&A that looks like, can you share a link to these documents? I know on the IDCC website, I believe for PHAC, all of the resources are posted, as well as our website, CPHA, under our IDCC project. A lot of those same resources are there. So I'd be happy to share both those links with everyone afterwards.
And if anybody's fast off the trigger with their simultaneous Google and attending this Zoom and wants to throw those links up there in the Q&A, then everyone's that way too. So
Please,
feel free to backstop me on this one.
Wonderful, yeah. I have a question for you, Dr. Shepherd. Through CPHA has done some work in surveys and key informant interviews, and I think a lot of people express a frustration with some silos, whether that be, with people in the climate change realm, people in the infectious disease realm, where we live in a country where we have people working in health at all different levels of government, municipal, people working in communities, federal. How can we really use scale, whether that be across sectors or across levels of government, to our benefit when we're working to expand on public health's role in tackling climate change and infectious diseases?
Yeah, so that's a great question. I mean, in every single file that I am currently involved in, the biggest challenge that people are raise on a daily basis is this fact that we still exist in silos, and whether those are jurisdictional silos or geographic silos or intellectual silos, they're real and they really get in the way of doing what we would like to do. And I think the pandemic taught us that, right? Mm-hmm. Where we were actually most effective was when we broke through some of those silos and got into a more collaborative space and a more interdisciplinary space. So I'd love to tell you that I've solved that question and that I have the answer to all of it. I'm always tempted to say the answer is, and then pretend to freeze on screen, but I don't think that'll work. You'll see something moving behind me, and it's very clear that I'm faking it. I think the answer is exactly what you're doing today. It's bringing people together, trying to link communities, working through things like the national collaborating centers, working through organizations such as your own, and then through some of the, in the more sort of government public health space, working through some of the collaborative tables. And we have those tables and they are interested in these. And I think as we see more and more of these extreme climate change events or climate change seasons, which is how I tend to think of last year, these issues are just going to continue to rise up. We see a similar challenge with the whole One Health space, right? And people are really working hard to crack that. And I think these two issues are really going to have to align at some point, because people, it's a lot of the same people around the tables. It's a lot of the same people who have the levers of action to try and solve some of these challenges. But I don't think we're quite there yet.
And thank you to Carrie, who has graciously pasted some resources into the Q&A there for anyone who is interested, as well as Morgan in the chat. We have a question from an attendee asking if you know if the IDCC fund, those funding opportunities are still open, or will there be opportunity for funding in the future?
Yeah, there will continue to be funding opportunities in the future.
Wonderful.
And Carrie can pop up, since she's the one who runs this. She can pop up if she can, our sort of timelines for that. Sorry to task you with that, Carrie, but you did reveal that you're here by sending me those links.
We have another question. Thank you very much for the presentation. How do you think the current public health approach to long COVID and reinfection will impact the application of public health measures for future climate pandemic One Health events?
That's a really good question, actually. I think that there's some obvious links between that people have made between the post-COVID condition, which I think is our official terms now for long COVID, but we know what we're talking about. It's the same thing here, and the Lyme disease space, and dealing with these challenging conditions that lack very crystal clear, black and white, easily binnable diagnostic tests. But linking it to the concept of pandemic One Health events, I'm not sure I'm following exactly where you're going with that, other than perhaps the interdisciplinary aspect. Certainly, I do think that we've learned with post-COVID condition that, an infectious disease doctor's view of it, a physiologist's view of it, a pulmonologist and a cardiologist view of it, and a sociologist, psychologist view of it are all completely different. And that the most successful places that have offered care for those individuals have been places that bring all of them together to have that more holistic interdisciplinary approach. And I do think that's what it's going to take to be looking at climate change, because it is such a complex issue. It's not just about ticks migrating northward. It's not just about smoke. And each of those areas within them have quite a bit of complexity, right? Smoke is not the same for a healthy young person as someone who has chronic obstructive lung disease or asthma. And so you really need to have a multifaceted view of what you're trying to accomplish when you're dealing with these challenges.
I think keeping that in mind, we have another question here that says, when thinking of small local public health units, what roles do you see us, as in RNs, RDs, etc., initiating to tackle the multiple dimensions of climate change issues? At times, it can be difficult to persuade rural communities that climate change and health should be prioritized.
So full disclosure, I grew up in a town of probably 25 houses with a general store. So I speak rural. It's where I come from. It's in my blood. And I know exactly what you're getting at. I think the answer starts with the old joke, how do you eat an elephant? And of course, the answer is one bite at a time. And I think we have this tendency to try and walk into communities with this is our large vision of the universe. This is our dogma. This is how we think everything should be. And we want to start changing 17 things at once. Whether they're relevant, whether they're not relevant, we have a one size fits all, very large, big vision, and you need to sort of get on board with it. And that just doesn't work. Doesn't work at all. I think that the community-based programming like you're talking about, whether it's at the health level, frankly, or just the community support level, is the most powerful place, actually, where we're going to see really changing attitudes around climate change. And the way that I think it has to happen is focusing on relevant time-linked events. You have the conversations about health and climate change when there is a smoke event, or when it is 40 degrees out, and when there's been a crop failure because there's been flooding or a hailstorm or whatever there's been, because you have your window where people are suddenly a little more open to hearing about it. But it's got to be tailored. It's got to be community specific, it's got to be relevant, and it's got to be important and offer something. If it doesn't have those elements, it isn't really a very useful thing to be doing in the first place. Or at least that's my view on it. And that's challenging, but the understanding of what elements of our climate change work are going to be important for people, that's actually best informed by the people who have boots on the ground.
No, I think a lot of us can relate to that and see that these conversations tend to have a spike when we're in the middle of a heat wave. So it's unfortunate that sometimes it takes those events to spark more discussion, but definitely need to take advantage and start talking about it as it's happening. One last question to end off the forum. Do you think we need a proactive approach in Canada, considering the changing climatic landscape, especially in terms of One Health initiatives?
Yes, thank you very much. I'll see you later. I absolutely do. The question is, what's the proactive approach? It's the same question that I just got asked today in an antimicrobial resistance meeting. Don't you think we should be being more aggressive about environmental AMR? And the answer, of course, is yes. But where do we start? Where is the area where science, evidence, data, surveillance is informing that we need to take action? I think we all recognize that we are living in a very tight place right now from an economic perspective. You only have to pick up the newspaper to realize it. People have not got resources. And by people, I mean everyone, from your average person walking on the street to the provincial, local, and federal governments, right? We have less resources than we need to do everything we want to do. So the key is finding where we can do things that are really going to make a difference. Where is it the most important that we identify potential risks that are coming at us out of the plethora of potential risks? And where is it that we know that we can actually put our fingers on the scale and affect change? And I think we're missing data there. We're missing evidence. We're missing knowledge as to what is truly effective, what is the most important issue. I don't think if I'd had this conversation with people about climate change 18 months ago, anybody would have put smoke and wildfires on their top 5 list as to this is what we really need to be ready for in Canada. This is what's coming down the pipe. This is the climate change thing I'm most worried about. But I bet you it's on everybody's top 5 list right now. So we need this information, and we don't want to be reactive to it. We want to be proactive, but you can only be proactive based on something. And so we need to be building this evidence base and then working intelligently with that evidence base to try and get one step ahead and not be one step behind.
Right. Wonderful. Well said, Dr. Shepherd. And that brings us to the end of our forum, everyone. Thank you.